So our next presentation, we're going to have a short opening presentation by HOH board member John Hyatt. John is actually a retired healthcare manager who spent his career focusing on issues of health and wellness. So John has volunteered to actually start up a new forum, monthly forum, that's going to be sponsored by HOH, that is going to be called the Health and Wellness Forum, right? Focusing not just on issues from an individual level, but also looking at health and wellness issues at more of a macro level as well, and even a global level. And so, yeah, this really kind of fits kind of what HOH is looking to do with our mission, which is really focusing on humanistic issues that are not necessarily the ones that have typically been considered part of, organizations like ours. But, health and wellness are very important issues for everyone, especially as John will do. He will actually look at these issues from a humanistic perspective. So, yeah, so John is going to kind of give an introduction to what, to the forum. So, please welcome John.
Thanks. I don't have a remote clicker and I'm being taped, so I'm going to have to stay right here. So I apologize for blocking the screen for those who, so just do your best. I don't know what else to say. We're in a small room. We're going to be in a different situation before long. But, I was thinking as you're introducing me, what to name this new forum, Health and Wellness Forum. And it occurred to me that we got the hungry heathens. How about the healthy heathens? That might be an idea. And Debbie, I've got an idea for you too. As I was thinking, we need, we got lots of opportunities for abiding and drinking. How about teetotalers? Sipping tea for charities in a coffee and tea shop.
There's a Starbucks in the shop with script, man.
Yeah. I'd love to do that. Okay, I'm going to take about 20 minutes to introduce this. And actually, it's a good fit, actually, with the presentation on dignity fits, death with dignity fits very well, actually, with the theme of health and wellness throughout the course of our lives. But having said that, what I'm going to cover is a few words about what it means to be a humanist and a progressive in this day and age, in Houston, in Texas, and what the stresses are involved in it. I'm going to spend some time on that. I was thinking about that this morning, so I threw out the other slides and developed a slide on this, because I think we're living in a particularly stressful time right now as a progressive, and I think focusing on this makes some sense. So then I'm going to talk about the rationale and the vision for this forum, and then some details and examples about that. So, when it comes to what we do, our HOH activities, particularly the advocacy work, the social advocacy work, and the volunteer work, is really admirable, and it does a lot for others in the community. It's a very positive thing, and it really makes a difference. And it makes a difference for us as individuals being involved in this. And there's two key things I'd like to just point out in terms of a positive impact that it has for us. And in seminars with this forum down the road, I'd like to touch more on that and discuss that more. But help to define the purpose and meaning in our lives. There's some research on that. It's much like a religious community in terms of what it does to create a framework for our beliefs and values. We do the same thing for our secular beliefs and values by being a part of this organization and by participating. And I think that's a really positive thing. And the second thing is being part of a social community, developing community. It's a challenge. We all know how much of a challenge it is, particularly living in an urban sprawl that we do. Our ability to get together face to face is a real challenge. I call that GU. You know, Debbie got a kick out of that when I first brought that up. Geographically undesirable, you know. We have to try to get together. We are so sprawled out. I did not expect that when I became a member of HOH. I thought maybe it would be more central, people would be more centrally located, but we're spread out. So it is a challenge. And, you know, so again, I encourage you to think about the stresses involved in what we do and to be compassionate towards yourself as the first strategy, you know, to deal with the stresses. You know, think about, you know, the stresses. We all know it's challenging to do progressive advocacy work. But have you spent much time thinking about how that impacts you in terms of stress? I think it's worth doing that, particularly in this time. And just to give some examples, look at HERO. The letdown, the discouragement, the grieving that has occurred since that went down the tubes for many people. And I think it's really cool that people use Facebook to dialogue a little bit about that after that happened. I think that's really healthy. We need to be able to have venues to discuss our feelings and our discouragement and our encouragement, you know, about some of the things that we're involved in. And that's one of the beauty of these discussion groups in these forums, is to be able to do that. You know, another one for me personally is just living in Texas. You know, I mean, I've got a brother-in-law in Philadelphia, and he delights in sending me East Coast media articles bad-mouthing Texas. And, you know, I'm going to have to let him know I don't want that anymore. I know it. You know, I know that it's... So I think that being aware of some of the stresses that affect... This morning, for example, I was reading an article on gun control, and it was mentioning in terms of the terrorist activities that being on the list, the federal list of known terrorist activities, does not preclude you from buying a gun can you believe that? Can you believe that? Now, on the one hand, that's incredibly discouraging. On the other hand, the Democrats might, you know, we might have a shot at trying to push something forward. But if there's any one thing that discourages me, it's the NRA. It just seems like we have this massive hopelessness about ever dealing with that. I'll get off my soapbox, but that, and you know, one more thing. Bernie Sanders, you know, as much as I love him, you know, he is soft on gun control and in terms of his voting history. And I just think it's a shame. I really think that there's an issue there that needs to be addressed. So anyhow, pay attention, be mindful of the stresses, and be willing to talk about those, and to be willing to take some action when you do feel stressed. I'm retired now, so I've got more time, but for those of you that are, I don't know how some of you do it in terms of being involved in all these activities and working and everything else that you do. It really impresses me. But learn to take care of yourself. Part of that means being able to disengage at times. Let's say Facebook webpage, you know, stop reading all of the, you know, negative things about everything that's going on for a while, if that's what your need is. So know when to engage and when to disengage as part of your self-care strategy. So my vision for this meetup, monthly meetup, is really a chance, it's not a lecture series, to offer a new humanist meetup that allows the comfortable exchange of information, ideas, and support related to the healthcare and well-being of individuals in the Houston area and beyond. So the scope is really pretty wide. So anything can go in terms of how we might proceed with those who are interested in participating. I'll get into some details about that in a minute here. So why am I personally interested in this? Well, you've heard some of that already. But professionally, I recently retired as director of the Employee Assistance Program at MD Anderson Cancer Center. 20,000 employees and faculty. We did a lot of things in terms of addressing workplace organizational stress and individual stress that might impact the workplace or even impact patient safety and threats in the workplace and a lot of different helping strategies for employees. And I did that for 16 years, and I worked in other industries, health as well. So I have and also worked very closely with employee wellness in terms of trying to address preventively some of the things. So I'm very interested in this area still, and I think that some of this can apply to an organization like this. That we think about humanism not just macro, but us individually as humanists. So really it's and personally, as I say, I'm retired. I want to develop more in the way of community because I'm not part of the work group that I was involved in before to speak of. So I'm looking at developing community with like-minded people, and I find that very valuable in terms of this organization. And as a humanist, how to live in the here and now, how to be present. I participate in yoga a lot, that helps, but we don't have another life to count on here, folks. So, sharing information, sharing ideas, sharing support about how we live this life, I think is really important. So to explore action, what we can do to help ourselves and take care of ourselves, as well as our advocacy and volunteer kind of work. Health and wellness is a very broad category that includes both preventive strategies as well as everything from the beginning of life to the end of life. So that's the health and well-being definition. I won't go into that. But from the perspective of humanists, again, it's living in the here and now in terms of what we do. And in terms of healthcare, it's taking charge of our health, doing whatever we can to impact healthcare in this country and abroad. The four key areas, and again, I'll probably go into this in another session later down the road, is paying attention, first of all, to how healthcare and the healthcare issues of today affect us. Paying really close attention, both personally and your family and your finances and everything else. Staying informed and sharing information. And a lot of that goes on anyway in the different forums. And rational decision making, a tenet of humanism. And then the support and the guidance when you are dealing with issues regarding health and healthcare and quality of life issues that affect you or someone else. And this is really critical. There's a lot of research, I won't go into today, but on the benefits of belonging to communities and having social support in terms of recovering from illness and your lifespan. So being connected is not just nice, it's important for our health. There's a lot of evidence on that. So the forum topics can really be, these are just examples I'm going to go into in a minute, but how we proceed, I really look at this as a collaborative thing. I've got certain topics that I'm comfortable and have presented on in the past, but I'm really looking for people too that want to collaborate on an area of interest to you in regards to healthcare or quality of life issues related to healthcare. And I'll go into some examples, and that might, so that you can come up with some information, because I look at this, it's not a lecture series, but a way to present information and then discuss it, because the discussion and the sharing of information is the critical part. And I know we'll do that, because this group has no problem speaking up. It's my experience. So no problem there. No problem there. The scope of what we talk about in terms of topics can be anything from individual all the way up to our planet, as far as I'm concerned. A lot of this may involve Houston politics and Houston commitment to healthcare as well. All right, some examples of that. I'll give just a few examples and then I'll be out of time. So, healthcare and the individual, billing practices. For example, balanced billing. Have you ever heard that expression? Balanced
Yes,
billing?
recently.
Oh my gosh. Surprises when it comes to billing. Sorry.
Okay.
Yeah, that is a critical issue. Genetic testing is a fascinating area. I'd love to bring in a speaker on genetic testing in the Genome Project. I think that's a cutting edge area. If anybody knows someone that has expertise in that area that might be willing to speak, I'd love to tell you. Telemedicine is also a fascinating area as far as I'm concerned. We're going to get more of our healthcare done via video hookups, and I think that's a healthy thing for our health. So, narcotics is something that I dealt with a lot over the decades. I'd be glad to share information about that. And Medicare, I've heard some chatter about interest in Medicare, and I know that there's a lot of us that are kind of in that age group where Medicare. I'm on Medicare now. There's also a concept called Medicare for All, which is an interesting concept. So we can maybe get a speaker on that as an example. Now, drilling down to well-being, managing anxious thoughts. I used to give that talk a lot in discussion in the workplace, managing anxious thoughts. Certainly work stress is an area that I can present on. Living in the here and now, I just like to have a discussion on that, as I say. Mental health treatment in Houston is a disaster. It just is an absolute disaster. And a lot of what our program did at MD Anderson was refer to resources in the community for behavioral health problems. And it is quite a challenge. I have a lot of ideas on that. Better sleep hygiene, something that impacts so many of us. And it's such an issue that people will not pay attention to. Healthcare workers are the worst, in terms of paying attention to sleep problems. Life transitions, another category of areas that we may want to look at in terms of life changes, retirement, planning for retirement, aging in place, and follow-up discussions with presentations that we've already had, like death with dignity. A follow-up discussion on that could be one of the areas as well that we look at on any topic. Now, there's also quality of life issues that are related to health care. I happen to really feel strongly that gun control is also a public health issue. And talking about gun violence and public health the public health community is getting more involved, and I'm glad to see that. Houston Transportation and Mobility Plan, they're doing a lot of work on that area right now. We had a speaker on that, I think, months ago. I'd love to have some discussion and some information on that. Climate change is being dealt with in other venues, but we still may want to consider that as well. I missed support for fellow humanists. Love to have some discussion about what, if anything, we can do with regard to providing support for people in this organization or for the humanist freethinkers outside of our organization, in terms of when people go through various transitions or life crises or financial problems or whatever. I mean, there might be something that we can do beyond what we're doing now in that area. So is this forum for you? I mean, so here's some questions to ask yourself. If you want better understanding of an issue, again, do you have personal experience with a topic? Whoops, I'm sorry. Okay. Do you want to get more involved? You know, do you want information about local resources? We can share information about that. Or is you simply want to be like-minded people that are interested in these areas? Okay, last slide. All looking at starting this in January. Trinity Mendenhall, I do have a room reserved. I don't have a confirmation yet, but for up to 20 on the second Thursday of the month at 7 o'clock, 7 to 8:30. That is a tentative reservation. We'll see if that gets confirmed. So I'll have more information that will come out on this, either through a meetup communication or Facebook or both. So that's all I've got. Any immediate questions around this? We may be pressed for time, but we have time for, yes.
Do you know when you'll meet and how often?
Monthly?
And where?
Yeah, at this point, looking at the second Thursday of the month was a time that they had available in terms of a room at Trinity Mendenhall in the Spring Branch area. A very nice community center. We're moving there with our general meeting.
What time?
7 to 8:30. Yeah. Yes.
Well, whatever it's worth, I already have a conflict on the second Thursday.
Oh, do you? Oh, do you? Gosh. You know, that's a challenge in and of itself, isn't it? I mean, yes.
Since I'm hitting my 10th decade, I came here primarily for to get material I'm definitely dignity. Apparently we won't be able to get to it, but I would like to have.
No, we're doing it.
I have some material on it, yeah.
Yeah, I'm going to shut up.
How can we get in touch with you?
Okay, yes, I'll send out, let's see, well, on Facebook? Yeah,
I'm
yeah.
on Facebook, I'm on all this.
Okay, yeah. My email is jwhyatt, jwhyatt 80@att.net.
Okay.
But also I'll put information out.
Yes,
Okay.
we're going to move on.
Thank you.